Emergencies can happen to anybody at any time. If timely, simple, scientific life support interventions are not provided in emergencies, many lives will be lost. The most important thing in an emergency is preparedness. Emergencies can be in the form of heart attacks, brain strokes, pregnancy-related. Emergencies, if allowed to continue, it will have an effect at the individual levels, at the family level, at the community level, and at the national level also. All over the world, about 5 million lives are lost every year because of injuries, and more people die because of other diseases which are called cardiovascular diseases, pregnancy-related things, infections. So we are talking about a condition where 10 million people die and more people become disabled because of emergencies. In India, every day, about 75,000 people face emergencies. Every 1 minute, there is a road traffic accident. Every 4 minutes, there is a fatal road traffic accident. About 720,000 people face sudden cardiac arrest in India every year. About 50,000 mothers die because of maternity-related or pregnancy-related complications. That is the gravity of the problem because of emergencies, even in India also. Unfortunately, 1 out of 5 in rural areas and 1 out of 4 people who are all having this emergency obtain treatment. On an average, if you are looking into that, 40% of the urban people are having this treatment access. Only less than 2 out of 10 people in the rural areas having access to the treatment in terms of emergencies in our country. It also reflects quickly that there's a great opportunity to save lives looking at the gravity of the problem of emergencies in our country. If you want to measure the opportunity of saving lives in emergencies, 1 million lives annually. In order to save these 1 million lives, we need to create a system of emergency response which can respond to about 30 million emergencies. Look at the mammoth of the problem. This is possible, which requires a unified 3-digit emergency number in this country, like 100 other countries where this sort of a unified 3-digit emergency number is existing. India also requires a well-equipped ambulance. We require not doctors, nurses who are very good in working in the hospital or facility-based environment, but we require paramedics and emergency medical technicians who can work in the out-of-hospital situations. Emergencies, for example, the road traffic accident itself, they are causing 3% GDP loss in our country. It has got a tremendous relevance to address them in a very methodical manner. From the city of Hyderabad, about 10 years back, a lot of synergy of multiple technologies, including information technology, telecom technology, the fleet or the vehicle technology, and the medical technology have converged and created a concept. For a few months, this integrated end-to-end emergency response services were demonstrated with a well-equipped ambulance and with a technology-centered state-level emergency response center. After completing this proof of concept where it will meet the Indian contextual emergency situations, which is no way inferior to the existing global leaders in the emergency response services, there was a strong need to scale up this sort of a integrated emergency response services. Touch wood, the selection of 108 number has really revolutionized the emergency response services in India. In this great land, we have people from different faiths, Christians, Muslims, Jains, Buddhists, Hindus. For all of us, this number is sacred, this number is significant, this number is respected, and it's considered very poised. And it is very easy for us who work in the emergency response services to create an impression and then see to that it is engraved, because in emergencies our IQ will come down by 50% and the recollection would be very quick when we have a number which is connected with the people of this great country. That is how the journey of 108 started from the city of Hyderabad. Now the challenge is how to ensure that with the difficult terrains, different geographical challenges in this country, how to create a process which would ensure high level of precision and performance and outcomes. As I was mentioning, the timely interventions are very, very important. This technological solution has enabled us to quickly locate where the emergency is by using GPS and GIS technologies. If 100 people dial this number 108 at any given point of time, 98% of the time the response will be given in 2 rings. That is the level of efficiency we have identified. In less than 180 seconds, we would be able to locate the emergency, subtype the emergency, and we also identify the appropriate ambulance and dispatch the ambulance towards the incident location. That is the efficiency we have created. So sensing the emergency, reaching the emergency was very critical for us. We were able to overcome that. But we had to create an out-of-hospital care, which is very, very important, and hitherto such sort of a robust process was not existing. We have identified a science graduate who had at one time of his life wanted to become a medical professional and a doctor. We have created a training program which will give them very large hands, a big heart, and then a head which can do some critical thinking and help the emergency patients. So thus, our process and a paradigm of sensing the emergency, reaching the emergency, and care has amalgamated. In India, because of the difficult terrain charges and myriad of emergencies we face, we have realized that in the absence of emergency departments all over, except some islands of excellence, we have to have qualified professional doctors who can sit in the centralized response center and would be able to guide the paramedic or the emergency medical technician in the ambulances. The doctors who work with us in the center consider the EMTs as their ears, eyes, and touch, and bring the most scientifically evidence-based protocols so that the treatment can happen as if we are there in an emergency department of a low resource setting, and transport the patient as early as possible to an appropriate nearest hospital, while giving highest priority to the patient. What is reflected as a red dot above this sense, reach, and care process is what has come out very useful for a difficult country like India with wide range of challenges. Another important learning was that not only leveraging technology, not only creating a well-equipped ambulance, it's very, very important that we need to ensure that what we do is documented. And what is documented should be analyzed so that there's a continuous learning and we can have a celebration for nanosecond and move ahead and see to that the service quality reaches some global standards. And to reach the masses, what we have realized was that we need to work with the state governments. The governments have got resources. The private efficiency can be clubbed with the public resources, and we can help the common man across the street, is what is called a public-private partnership. With this concept of integrated emergency response service, with this framework of public-private partnership, we were able to reach about 15 states and 2 union territories, reaching 750 million population out of 1.3 billion population in about 10 years' time. We faced a lot of challenges. Some of the pictures shown here, they reflect our last-minute challenges. Be it in the foothills of Himalaya, where the village is in the valley, be it in river districts of Assam, there is a sudden increase in the levels of Brahmaputra, or in the deserts of Rajasthan. The last-minute challenge has been a phenomenal area where we need to work hard and see where we can find some innovative solutions. We have started moving from the four-wheeler ambulances to boat ambulances. To navigate in the small bylanes in urban cities, we have started two-wheelers and the scooties also. As I was mentioning, the villages in many of the sub-Himalayan districts, there will be villages will be low, so we have asked civilians to use the palanquins and see to that the emergency victim is brought by the time the ambulance reaches there. So the many ways we have to learn and see to that the last-minute challenges are addressed in this country. As a medical doctor, I was told that the God has created all the wherewithal for the childbirth. We use a word called masterly inactivity and watchful expectancy. I'm showing a case of a triplet born in the ambulance and delivered by an emergency medical technician and ably assisted by the doctor. I'm proud to say that with the advent of these 108 services, one of the important goals which were promised to the United Nations, the maternal mortality rate, there was a reduction of about between 20 to 15% in various states we operate. Many of the young people who come across traffic accidents, many studies have revealed that the outer ring roads, the national highways and the state highways are the vulnerable pockets for the road traffic accidents. Out of 365 days, 329 days, we observe multi-casualty incidences, where the critical most patient has to be identified from the scene, he has to be triaged and should be prioritized in terms of transporting to these nearest appropriate hospitals. So we have created a system where it not only addresses the individual emergencies, multi-casualty incidences, where we can mobilize more number of resources. Let me give one example. In Dilsunagar bomb blast, within 2 minutes, our first ambulance has gone there. In about 28 minutes, 17 ambulances were able to mobilize and shift about 51 patients to private and Usmania hospital. We had an opportunity to develop a cadre who can work independently in the out-of-hospital situation. We were able to create a basic emergency medical technician and advanced emergency medical technician. But we knew that the journey has started, but there are very large goals we need to reach. So we identified who is the best in the world, who can contribute and contextualize to the Indian emergencies and try to beat the best. The collaboration has helped us to collapse a lot of time in our journey of providing emergency response services. In these 10 years, cumulatively, we have responded to about emergencies. Out of these, certain cases which are very, very critical, which would have been not possible to have sustenance of life, we call them life saved. We have had an opportunity to save about 1.8 million lives out of the 48 million patients. You will be surprised to know that about 433,000 childbirths have happened in our ambulances all across the country. The 45,000 workforce, which I represent proudly today, every day an opportunity to save about 900 lives and assist about 140 emergency childbirths in ambulances. 88% of the beneficiaries are rural people. 90% of the people belong to the low socioeconomic status or below poverty line. I just wanted to tell you that Our operations is ambulance, but our business is saving lives. You would see that many cities are stopped or not able to measure the number of lives we save in a given period of time, or how many lives we lose in a given period of time. And survival rates are very, very critical. As you would appreciate that on the rightmost, the hospital ring, there are now very good hospitals spread in most of the urban areas. Fortunately, the ambulance system has standardized, stabilized in our country. But there are 3 rings which are on the left side where we require a socially conscious citizen who can immediately give a ring to this number 108. We are not very happy with the number of cases who are using this number 108 emergency response services in all the different parts of the country. My humble appeal to you is that from this August audience is that please enable people to use this free, toll-free emergency number in case of emergency, and that is what triggering the emergency response or the reflection through a telephone number is. But what is very, very important today in the context of the crafting for the future is that while the ambulances take about 15 minutes to reach, there's a lot we socially conscious, able-bodied persons can do. In case of a road traffic accident, when there is an acute or a heavy hemorrhage, active hemorrhage, we can do some compression and then we can prevent deaths. If sudden cardiac arrest is there, we can do some hands-on chest compressions and save lives. 50 to 60% of the lives can be saved by very simple scientific interventions, which is now lacking. I remember Dr. Kalam was asking, what is the contribution we can do? The contribution we all can do is connect the dots. The first dot is at the community level, the second dot is in the ambulance, and the third dot is in the hospitals. So I'm now trying to bring to all of you the first dot which we socially conscious, able-bodied citizens can really do, and that is possible through a mechanism called first responders training. It's a half-a-day to one-day training program where skills can be acquired for some first-rate, scientifically safe things. If we can start in the city of Hyderabad, which about 100,000 people can be trained in a given period of, say, 1 year or 2 years down the line, I'm sure that we would have more safe communities. 50% of the deaths because of the common emergencies can be saved because you are triggering an emergency response services. Before the ambulance comes, you are able to manage the situation. You are able to create assurance. I just wanted to close that. Dr. Kalam has said that success lies in saving lives. And I also want all of you to join me in giving back to the society and enjoying the joy of giving back. Thank you.